Do you know pancreatic cancer is the second leading cause of worldwide deaths? What's more shocking is it has no clear symptoms and cannot be diagnosed in the early stages, even not on imaging scanners. That's where your life gets into real danger. To get you in survival mode, this video covers the top 10 warning signs that show you're a victim of pancreatic cancer. Let's fight this cancer head-on before it gets over you. Number 1. Jaundice. Have you recently noticed a yellow discoloration in your skin or whites in your eyes? If yes, it's one of the visible signs that you're at risk of pancreatic cancer. This yellowing, commonly known as jaundice, is strongly associated with different health problems. It blocks your bile duct, which is the tube that carries bile from the liver to the small intestine. And if you can remember, your pancreas is located near the bile duct. So, by obstructing this duct, jaundice leads to the formation of a tumor in the head of the pancreas and complicates the process for you. But the story does not end here. Once the bile duct is blocked, it disturbs the normal flow of bile. And guess what? The bile starts to build up in the liver. For those who are not familiar with bile, it contains a substance called bilirubin, a yellow pigment that is a byproduct of the normal breakdown of red blood cells. When bile cannot flow into the intestine, bilirubin accumulates in the bloodstream. The buildup of bilirubin in the blood leads to the characteristic yellowing of the skin and eyes, darkening of the urine, and various other health complications. Number 2. Abdominal pain. If you're experiencing frequent abdominal pain, it should not be ignored, as severe pain can be a symptom of pancreatic cancer. Although many people consider it a normal abdominal discomfort, often resulting from stomach issues or poor digestion, that's not always the case. In fact, scientific studies have shown that a severe level of pain in the abdomen radiating to the back can be a clear sign of an abnormal pancreas, leading to deadly cancer. If you're wondering how abdominal pain can be the cause of life-threatening cancer, then you should know the science behind it. As the pancreatic tumor grows, it can exert pressure on nearby organs, nerves, and tissues. This pressure can cause significant pain, often felt in the upper abdomen, and sometimes radiating to the back. What's worse, the pain can increase over time and put you on the deathbed if left unnoticed. Number 3. Weight loss. At first, it might sound pleasing to obese people, but the fact is, unintended weight loss can be a leading sign of pancreatic cancer. It makes it difficult for you to maintain your daily calorie intake and thus results in loss of appetite. One thing worth mentioning here is how it can lead to complicated pancreatic cancer. Well, the pancreas produces enzymes. These enzymes are responsible for digesting the food you eat. Now, if a tumor comes in the path of the pancreatic duct or interferes with normal enzyme production, it can cause disruption in digestion and nutrient absorption. Moreover, the cancer cells can increase the body's metabolic rate, causing the body to burn calories faster than normal. Ultimately, this will lead to unintended weight loss. Number 4. Loss of appetite. Here comes the most interesting warning sign. The reduced desire to eat or feeling full after consuming small food is a clear symptom of pancreatic cancer. The cancer can cause changes in hormone levels, particularly insulin. These hormonal imbalances can impact appetite and metabolism. Remember, we talked about abdominal pain previously. This pain or discomfort also reduces your desire to eat or makes it uncomfortable to eat large portions of food. Number 5. Digestive problems. Sometimes, minor digestive issues can lead to severe health complications such as pancreatic cancer. Problems like nausea, vomiting, diarrhea, or indigestion are significantly associated with the abnormal pancreas, leading to tumor formation. Moreover, it can block the pancreatic duct. The pancreas produces digestive enzymes that are secreted into the small intestine via the pancreatic duct. A tumor in the pancreas can block this duct, preventing enzymes from reaching the intestines. This can lead to malabsorption of nutrients, causing diarrhea, weight loss, and greasy stools. The pancreas also produces enzymes necessary for the digestion of fats, proteins, and carbohydrates. When cancer affects the pancreas, its ability to produce these enzymes is compromised, leading to digestive problems like indigestion. Number 6. Onset diabetes. When talking about health issues, diabetes comes on top of the all. From cardiovascular diseases to pancreatic cancer, diabetes is the hallmark of all health disorders. People with long-standing type 2 diabetes have a higher risk of developing pancreatic cancer. The exact mechanism is not fully understood, but chronic hyperglycemia and insulin resistance may contribute to cellular changes and inflammation that increase cancer risk. Moreover, obesity and insulin resistance, common in type 2 diabetes, are linked to chronic inflammation and changes in insulin and glucose metabolism, which may promote the development of pancreatic cancer. In some cases, pancreatic cancer can cause diabetes, especially if it affects the insulin-producing cells of the pancreas. This type of diabetes often appears suddenly and can be an early sign of pancreatic cancer. Number 7. Blood clot. Ever seen the gel-like masses formed by the coagulation of blood? These blood clots are a visible sign of pancreatic cancer, posing a major threat to your health. Pancreatic tumors can secrete substances such as tissue factor and cancer procoagulant, which activate the coagulation cascade and increase the risk of blood clot formation. It can also cause inflammation in the body, which can contribute to a higher risk of clot formation. Inflammatory cytokines released during cancer progression can activate clotting pathways. Patients with advanced pancreatic cancer may have reduced mobility due to pain, weakness, or treatment side effects. Reduced movement can increase the risk of blood clots, particularly in the legs. The presence of blood clots in a patient with pancreatic cancer can complicate the management of pancreatic cancer. Number 8. Fatigue. A common yet visible sign of pancreatic cancer is fatigue or feeling tired. If you feel out of energy, it's due to the changes in your body's metabolism caused by pancreatic cancer. This cancer can impair digestion and absorption of nutrients due to insufficient production of digestive enzymes. This can lead to malnutrition, which causes fatigue. It can also cause anemia, a deficiency in red blood cells, which reduces the oxygen-carrying capacity of the blood and leads to persistent tiredness. Treatments for pancreatic cancer, such as chemotherapy and radiation therapy, can also lead to significant fatigue as a side effect. Number 9. Enlarged liver or gallbladder. When conducting an image body scan, you might observe enlargement of your liver or gallbladder. This is a visible sign that your pancreas is not working well and is at risk of developing cancer. Once developed, the cancer can spread, metastasize, to the liver. The liver is a common site for metastasis because the blood flow from the pancreas is directly connected to the liver via the portal vein. When cancer cells reach the liver, they can grow and form tumors, causing the liver to enlarge. Number 10. Changes in stool. Does your stool appear greasy, or does it take a while to flush? If yes, that's another symptom of pancreatic cancer. When the pancreas is unable to produce enough digestive enzymes, it can lead to malabsorption of nutrients in the small intestine. This can result in changes in stool consistency, such as greasy, pale stools that are difficult to flush. As pancreatic tumors grow, they can block the flow of digestive juices and bile into the small intestine. This can also lead to changes in stool consistency. This wraps up the 10 common and visible signs of pancreatic cancer. Remember, your pancreas is a small, pear-shaped gland that holds the key to your life. Therefore, it's super essential to check for any abnormalities in your pancreas before they lead to complications like cancer or tumor formation. Let us know in the comments below if you have any of these symptoms, and subscribe to this channel for more updates on enjoying a healthier and happier life.